Today we're going to be showing how to plan zygomatic implants in Romexis 6.1. This is a case that I've already have planned for the most part, and when I get to the tilted implants on a case like this, I have to decide whether we're going to use regular tilted implants, or if we're going to use palatally placed tilted implants, or if we're going to consider zygomatic implants. Oftentimes that decision is going to be made on the day of surgery, during surgery, but I would go first for, on this case, a palatal placement, and if that's not feasible, then I would go to the zygomatic arch. Sometimes, depending on the anatomy, I would just go ahead to the zygomatic, but when I can, I try to preserve the zygomatic implant for the future if needed. Okay, so the first thing we're going to do, which I've already done here, is to draw the panoramic curve. So we're going to get into, let's see, we'll get our axial slice or axial plane going right through the maxillary arch, and go to draw a panoramic curve. And let's see, we can just go ahead and do that again and draw that right through here. And the next thing we're going to do is slide over to where we could see the zygomatic arch, and I'm going to select sagittal plane here, and that'll give us an idea of where we are. Then I'm going to go here and slide up to make the width of our slice here about 70 millimeters. Alright, so you can see here on the lower area I've got a nice view of the zygomatic arch, and we're going to see, I'm going to slide over, I'm watching this lower right box here, and that's about where it's probably a little anterior to where the exit point would be, but we'll go ahead and see what we can do here. We're going to go to implant library, and we're going to go to Southern Implants, Oncology and Zygomatic. You can see it was blue, and that's just showing that it's one of my favorites. And I'm guessing on this one we're just going to start with a 35 millimeter and see how that looks. And I'm just going to select set default just in case we use it on the same one on the opposite side. So I'm going to come here to the middle slice and left click. Let's see. There we go. Alright, and this is just showing an implant body. It's not really showing that one end is the platform. So we're just gonna, we don't have to flip that one like we do some of our others. Okay, let's see. Alright, and so it's looking like it's probably going to be a little bit long. I'm going to go ahead and just switch this to a 32. And we're going to replace that. Close. Okay. Alright. Now I'm going to swing over to the patient's left side. And there you go. We are going to add implant. This is again going to be I believe the 35. Left click and drag that around. I'm going to get the platform about where I'd like it to be, and you can see that one would be too long as well. Okay, so now we're going to switch over to Explorer View. And in Explorer View, let's see, I'm going to maximize this. Okay, so now what we can do, select the implant. Actually, it looks like it does. Okay. Okay, so In the other view, I really couldn't see which end was the apex of the implant. So we're going to have to flip the one on the right, but the one on the left, it looks like the apex is correct. So we're going to see about getting the apex in the ideal location here. So what I'm doing is positioning the skull, and then I select the implant and hold Control and Shift, and I can move the apex of the implant. Now also we hold the same button and grab the body of the implant, and we can move the entire implant bodily. I'm going to go back to the implant view, and on the patient's left side I'm going to select the implant, right click, and then select flip, and that'll get the apex of the implant where we want it. So now I'm going to focus on getting the platform of the implant in the most ideal location that we can. On this case, there's very little bone underneath the sinus, so we're just going to rest it right on that bone, not really going into it. We're going to slide around to the patient's right side, and we're going to do the same thing here. Try to get the apex of the implant in the most ideal location. Okay, now let's see. We're going to go back to Explorer view. And we're going to focus on getting the apex of the implant in the most ideal location that we can. And looking at this, I think I'll move this implant bodily forward some, and then grab the apex and move it back. There we go. Alright, so we're looking here. I'd like to get, you want at least 2 millimeters of bone buckle to the implant. And this, this gives us a really good idea of what we're going to do on surgery day. I'm going to go back to implants. And now I'm going to reevaluate. It's pretty decent platform placement there. This one is a little bit, it's gotten a little too far up. There you go. Okay, I'm going to zoom out here. And it looks like we've got the implant in a good bit of bone there. And that's very nice. It's pretty much going to be extra sinus on this side, on the patient's left, and then on the right side, also extra sinus. And again, in plenty of bone there, and it looks like the apex is going to be right at the outer layer of cortical bone there. So, one thing we can do, select this implant. Let's see, I think I've got to come over here and select it. One thing we can do, these are a little hard to see. We could just come in and change the color. Oh, there we go. I keep trying to do the wrong thing here. I'm going to double click on the implant. There we go. Now we've got both of them in blue. And that's going to show up a little bit easier of a contrast against that white bone. So all in all, I think this is a nice looking setup. Some cases when they have more resorption, or just depending on their anatomy, it's a little bit more shallow of an angle. Trying to leave enough room here that if you had to go in with a second implant for a quad, we would, but certainly we have multiple options. It looks like we're going to be able to place 2 anterior implants on this case, no problem. Certainly we could try the transnasal implant or the intranasal implant, whichever you want to call that. And so basically in a case like this, the decision between this palatally placed angled implant and the zygomatic implant is, one of them is quality of bone. If we don't have quality bone here, it doesn't matter. If the sinus comes too far forward, it's not an option. You have to go to the zygomatic implant. And then the other is the AP spread. So if we weren't able to get the pterygoid implants and we wanted a little bit more AP spread, the zygomatic implant would be certainly able to give us a little bit more of a distally placed implant. And yeah, that's pretty much, that's how we plan these digitally. I also like to 3D print a model so I can hold it in my hand and evaluate and study the anatomy prior to the surgery. But it's nice also just to have a digital reference of all the directions that we could go or can go on surgery day. All right, thank you very much.